Welcome everyone who's here, and we'll just give a couple of more minutes for people to join in. Um, Bear with that. Thank you so much. Hello, everyone. Welcome, and thank you for carving out time in your busy schedules to be with us for this online conversation, working towards immunization equity in the Immunization Agenda 2030, or commonly referred to as IEA 2030. My name is Vinita Gupta. I'm a maternal and child health physician and a human rights lawyer, and above all, a health equity advocate. A journey that started more than 2 decades ago with a simple yet very fundamental question from a poor woman in my outpatient post. She was holding my prescription in her hand and she asked me, what good this paper is, and what are you doing if you cannot give me medicine? But that story is for another day. I lead Action Global Health Advocacy Partnership Secretariat in Washington, D.C. And today it is my pleasure to welcome you all to this session hosted by the Gavi CSO constituency in partner with Action, Results, Save the Children, and Gavi. We have an excellent panel to take us through this important conversation. Vaccinations, and vaccine equity is on our mind. Please share your thoughts through chat, Twitter, or other social media platform. During the sessions, we'll be displaying speakers and panelists' handles on Twitter and also organizational contacts as well. So you can use those and communicate with larger audience, share your thoughts, ask your questions. Please, let's make it very interactive. We'll answer a few questions from the chat and also continue to engage on Twitter after the event as well. The hashtag for this conversation are vaccines work and vaccines hashtag bring us closer. So please use them. We will be live tweeting. Let's make it dynamic. This event is being recorded and will be shared with the attendees and larger community. So during the session, we will explore vaccine equity in the context of IEA 2030 and the unique role of civil society in holding the governments accountable for the implementation and delivery of this new global agenda for immunization. We'll also discuss strategic shifts in immunization governance throughout the pandemic to ensure that lessons learned on health equity are captured and we learn from them and improve as we go forward in recovery after the pandemic. We'll have brief presentations, a round of questions with panelists, and then answer, as I said before, a few questions from the audience. Now, let me start by introducing our esteemed panelist, Dr. Peter Singer. He's special advisor to the Director General, World Health Organization, who the whole world likes to call Dr. Tedros. Dr. Singer supports the Director General to transform WHO into an organization sharply focused on impact at the country level. He's also a professor of medicine at University of Toronto. Then we have Dr. Chizoba Wanadi, a public health physician, Nigeria country director at International Vaccine Access Center. Also founder of the Women's Advocates for Vaccine Access and the Secretariat of National Platform Expanded Civil Society Initiative for Immunization. Dr. H.M. August Samsudin, chairman of COVID-19 Command Center, Muhammadiyah, Indonesia. We have Miraf Solomon, health and nutrition specialist, Save the Children, Ethiopia. Maki Igrashi, regional representative and health coordinator, IFRC Regional Office, MENA, based in Beirut. And then we have Dr. Ephraim Lemango, WHO Regional Office for Africa, EPA Essential Programs on Immunization. What a great panel we have today. And we are so fortunate to have them all to share their thoughts. Now, let's begin with the first session. What is new in IA 2030, Immunization Agenda 2030? And now I hand over the Zoom floor to Dr. Chizoba to discuss what is new in IA 2030. Dr. Chizoba.
Thank you very much for that kind introduction, and thank you to the organizers for the invitation to speak. My job this morning is really simple. I want to set the stage for the conversation that is to follow, and that is to explain what the IA 2030 is. So Diane, yes. So please, can you make it, thank you. So the IA 2030 is a global vision for immunization for the next 10 years. It really sets the stage for all partners, all stakeholders to be aligned on what we as a world want to achieve in immunization by 2030. It is an ambitious global strategy, and it will maximize the life-saving impact of vaccines everywhere. So Vineta, you asked what is new about IA 2030. What is striking about IA 2030 is the focus, the laser sharp focus on equity, on leaving no one behind. So it is baked into the DNA of this strategy that we cannot afford to leave anyone behind on immunization. So no matter where you are, no matter who you are, no matter the country you live in, your socioeconomic class, IA 2030 will not leave you behind. So that's the central message of IA 2030. And why, next slide, please. Next slide, please, thank you. So why is it important to leave no one behind? What we see here is a slide from UNICEF that tracks immunization coverage over the last 3 decades from 1980 or thereabout. And in the bars you see there are, these are essentially the number of children who are unimmunized or unvaccinated. And the line you see is the immunization coverage measured by the 3rd dose of the pentavalent vaccine. If you look closely at the graph, you will see that the line has stagnated at 85%. So 85% coverage over the last 10 years. It meant that we were not making as much progress as we had done in previous years. So immunization coverage had stagnated. If you look at the bars as well, you see again that there is a steady line of children, about 20 million children who remain under or unvaccinated every year. So one of the key things with IA 2030 is to make sure that we are targeting these children, particularly the children who have not received any vaccine at all from the routine immunization system, the children that are called the zero-dose children, which will be spoken about later in the course of this presentation. So that's just a snapshot of where we are as a world on immunization. The bottom line is that we have made progress over time, but that progress had stalled, and we need to push ourselves further so that we leave no one behind. Next slide, please. So every good strategic document, must start with a vision. Where are we heading to? And it also must have goals, right? So like I said before, the vision of IA 2030 is we want to see a world where everyone at every age, everywhere, benefits fully from from vaccination for their good health and for their well-being. And we are going to track this with a series of impact goals. So we want to see the mortality and morbidity reduction from vaccines. We want to see that people have access to vaccines. And then we also want to see that there is immunization forms that basic foundation for strong health systems. Next slide, please. So IA 2030, this strategy that we're talking about, there has 7 priorities, strategic priorities, and 4 core principles that undergird the actions that IA 2030 is putting forward. So those strategic priorities are listed here. I'm not going to go over them, but what I just want to highlight to you is that you can see that coverage and equity is one of the key strategic priorities, meaning that we as an immunization community, we are going to focus on ensuring that there's coverage and equity, and that's the subject of today's webinar. But I want to underscore the principles because, principles are, the tenets by which people live. And in this case, the principles of IA 2030 is really the lens through which IA 2030 sees itself will be delivered. You see here that they are putting people at the core of it. So it is people-centered, it is country-owned, it is partnership-based, and is data-guided. What this means is that this document is not a global document that was designed somewhere in Geneva by some experts. No, it has gone through a series of consultations with stakeholders at all levels. And this document actually should be owned by every single one of us, right? It takes a bottom-up approach to what we want to deliver in the next 10 years. So country-owned is really, really important. But what does that mean to us as civil society organizations, as as regular people, as just the general public? Let me tell you what country-owned means in this particular context now that we're about to launch the IA 2030. Next slide, please. So as a vision for the world for immunization, IA 2030 is going to be launched this month this month and next month in a series of events, right? So we have World Immunization Week coming up. And here I show a timeline of the series of the touch points and the moments that IA 2030 is going to be slowly unrolled or unfurled to the general public. The first one is around what we're doing now, which is we're engaging communities with technical briefings and all that. So as civil society organizations, what we really expect is for us to be engaged. Let us come and learn and understand what IA 2030 is. And then also situate ourselves, our organization, in helping to deliver that laudable vision of leaving no one behind on immunization. So this type of webinar is to sensitize you And then thereafter, you can dig deeper and find out, I'll show in a later slide, where you can get more information about this immunization agenda and how you can be a part of this immunization agenda. Next week, or is it this week, there's going to be a launch of the IA 2030, and that will be launched by Dr. Tedros himself in a global press conference. And he's going to introduce IA 2030 while talking about COVID at a press conference. We all know that COVID, it has grabbed the attention of the world. So, we need to, key into these moments and also play a part, play our role in elevating this global strategy. And then in May, during the World Health Assembly, that there's also going to be a launch, a celebratory launch of IA 2030 with side events and all. Another opportunity for us to key in. But it doesn't end there. We want to see continuous action. We want to see continuous engagement of the civil society organizations and the general public. We call this the movement. We want to see a movement behind IA 2030. Sort of like, when the MDGs or the SDGs were released and, it became a household name. Now, next slide, please. So there are a series of campaigns that are happening. We have the World Immunization Week. There are lots of creative assets that are available, Twitter toolkits, messaging that can be used, that can be used for advocacy and for engagement on social media. So I would really urge all of us here to key into this movement, this IA 2030 movement. And then finally, I want to show you, go to the last slide, please. I want to show you where you can get more information about IA 2030. There is a website now that's available, and it sets out in details these things I have touched upon. So you can go to the website, get information about IA 2030, and also get the social media toolkits and communication toolkits that you would need to join in the launch and join in the elevation of the critical message of IA 2030, which is leave no one behind on immunization. So much more critical now that we are facing this COVID pandemic and the vaccine shortages that we're seeing. The message of IA 2030 is relevant today much more than ever before. Thank you very much.
That's great. Thank you, Dr. Chizoba, for sharing message of the IA 2030. Indeed, no one left behind, health equity and vaccination equity. Audience, please do share your thoughts and questions with Dr. Chizoba on Twitter. Her handle is Chizoba Wanodi, and then also the website that Dr. Chizoba referred. Please do visit it. Now let's go to CSO perspective. And we have amazing panelists from Africa, Asia, and talking about fragile and emergency settings to share the challenges and the solutions of achieving vaccination equity. Now, my first question is to Miraf Solomon, Save the Children, Ethiopia. Miraf, what do you think are the key equity challenges in your specific context? Can you please talk about who are the last minute communities with all of us? Miraf.
Okay. Thank you so much for giving me this opportunity to be in this webinar, speaker. Before going directly to your question, let me give you a background of Ethiopia in general in the health system. So Ethiopia is the second most populated country in Africa next to Nigeria with a population of over 110 million. And the health system emphasizes on disease prevention, health promotion, community empowerment and partnership, and equity is one of the health sector transformation plan priority agenda. So Ethiopia has made a remarkable progress over the last decades in reduction of child mortality. So under 5 child mortality has declined from 166 per 1,000 live births from the year 2000 to 59 per 1,000 live births in 2019. So vaccination is one of the high impact key interventions Ethiopia has scaled up for reduction of child mortality. There is also progress in vaccination coverage through the years, which has increased from 18% industry coverage in 2000 to 61 in 2019. But there is a huge variation among regions, both in mortality and performance of high impact programs. When we look at some of the regions, for example, in Afar regions where the population is, majority of the population is pastoralist and semi-pastoralist, the under 5 mortality is 125 per 1,000 live births, while the average, the national average is less than half, which is 59 per 1,000. And vaccination coverage for this region for Pentastri is 26, while it is 93% in Addis Ababa. So you can see the wide variation among the different regions. So poor infrastructures, including road, electricity, water, shortage of trained manpower, interruption of supply and vaccines, interruption of service, and unavailability of vaccination service in some of the health facilities are among the challenges, including low awareness of immunization among the community. And COVID, the pandemic, has also further challenged the weak health system and affected the coverage and also induced vaccine preventable disease outbreaks. To narrow this equity gap, Save the Children is a member of the national and subnational immunization task forces, providing technical support. And we implement immunization projects in 3 out of the 4 developing regions with low immunization coverage. So we support expansion of vaccination service in these regions through supporting outreach and mobile vaccination sessions for communities residing far from health facilities, and provision of solar-derived vaccine refrigerators for facilities without one to provide immunization service. And we also support capacity building for service providers to deliver quality immunization service and raise demand in the community by engaging influential leaders in the community and community volunteers who are have a good reputation among the community. Through all this and our advocacy, if first is to raise finance for and priority for immunization and equitable delivery of vaccination. Only in last year, Save the Children has contributed for the vaccination of over 500,000 children in those regions. And we have also successfully achieved increase of finance for immunization in some part of the regions we are working in to expand delivery of immunization service for vulnerable children.
Thank you, Mira, for sharing all the information and also doing all that you do for mobilizing resources to reach the last mile communities. Thank you. And now let's go to Dr. Samsudeen. Dr. Samsudeen, can you please share with us the work your organization is doing to mobilize communities to improve vaccine equity within the populations, within the country? So what is your organization doing? Please share with us. Thank you.
Okay, thank you, Benita. For benefit of all of you that you do know Muhammadiyah, Muhammadiyah actually is reached 100 years of service in Indonesia because it was started in 1912 actually. So our organization running a quite big opportunity because we have hospitals, we have schools, yeah, we have just to give you overview what we have in Indonesia. Here we are. That currently we have a 115 hospital running. This is the faith-based organization, and 85 of them now serve as a vaccination center in Indonesia. The other is we do put our all resources to go for the vaccinations because we also have a 12 faculty of medicine in Indonesia and also about 37 nursing school. Yeah. It's very important in Indonesia, especially on the Muslim community, is the one who should lead by example. So on that case, we do have some rule and regulations. This is Muhammadiyah try to support the government, yeah, especially on the accelerate the vaccination, and then support the FDA in Indonesia and also health protocols is very important. Secondly, is during today is the fasting month that everybody is fasting, but we do allow vaccination during Ramadan. On top of that, I just show you that the lead by example is very important. The chairman of the Muhammadiyah, Professor Nasir, and his wife is also vaccinated. And we do use our facility, schools and offices to become our centers. And this is just example. We mobilize many doctors and also nurses to do the vaccinations. We do a lot of vaccination in Indonesia, which is just in the capital of Jakarta. We do also at the school. So this is the hall of big school. We invite people to go for the vaccination as well. The other is just to show you also for the teachers, we need to put vaccination for the teacher as well. We also do the interfaith vaccinations. Yeah, so we invite all the belief and religions to go for the vaccination. On top of that, we also do the vaccination on the region. That's very big numbers on this one. And this is our part. However, I would like to highlight that the challenge actually is on the how can we persuade people to come to the vaccination center. That's the first thing. The second one is the today is of course the availability of the vaccine, you know, and the third one is the implementation as well itself, because today we only have 4% vaccinated all over Indonesia. The population is almost 270 million. So when we do now is still 4% out of the population. If you see the geographical area as well, the distribution has become one of the challenges in Indonesia. The other challenge is that when we talk about COVID, everybody now look at the COVID and almost forgot the other vaccinations. That's also the big challenge. So the challenge now in our hospital is how to keep up the other vaccination except COVID, also for the children and everything, become one of the priority. Yeah. I think that's what I'm going to share at the moment. Vinita, back to you.
Thank you so much for sharing. And indeed, working with the government is crucial, and the community is at the center of the multi-stakeholder response that we need to reach everyone. And it's interesting what you mentioned that with the COVID vaccination, which was in a record time developed, and how it's a competing priority to other vaccinations, because we need all of them. And it reminds me of the vaccination for tuberculosis is like same as it was my great-grandfather had for him. So we haven't moved on some of the vaccination, and this is a time for us to balance and put forward and engage the community for vaccination for all, and all vaccinations for all. And that's IA 2030 agenda as well. Thank you so much. And now my next question is to Maki. Maki, what has been the best practices in immunization governance throughout the pandemic that could move the effort close the equity gap in access to routine immunization? What a great segue into what we just discussed. Over to you, Maki.
Thank you very much, Vinita. So I'm going to introduce some how and what we have been doing in the MENA region. MENA region is Middle East and then North Africa. We are covering 17 countries, and if you don't mind to share some of the slides to easy thing. So that as IFRC as global, we have 192 countries covering. In the MENA region, we have 17 countries. So we have a Red Cross Society's preparedness and rollout, where these 5 pillars advocate the fair and equitable distribution of COVID vaccine, trust, build community trust for the COVID vaccine, and the health support delivery of vaccine and reach to the most vulnerable population. And then lastly, 5 is maintain, everybody mentioned about routine immunization included to the maintain those services. And to do that in MENA region, as you may know, so we are under with the protracted crisis, conflict, occupation, civil unrest, and sanction, and the counterterrorism measure, economic crisis, and also refugee crisis. For example, we have 20 million refugees in this region. That's almost 1/3 of global displaced population, and also 30 million people need of the health. Also limited technology, and also limited access to the health coverage and also insurance in this region. So for in MENA region, so we have an auxiliary role to support public authorities to advocate equitable access to the vulnerable population, such as regular and also reported the migrants and refugees, and also trust to build through the communication and community engagement, misinformation and the remote management, and the health part is monitoring and the RPC post-vaccine observation, also reach to the underserved communities already I mentioned, also the elderly people, disabled physically and the mental disabled people, and also women as well. Also the maintain the public and also pandemic and epidemic preparedness, that's including not only COVID or the immunization, and also the community-based surveillances. So the specific activities we are doing, and a great example and experience in this MENA region. So we are part of a third-party monitoring to be as an independent and neutral entity to monitor equity and equality of vaccine campaign in the country. Also expanding the national society, cross-request and national societies engage, and also including a pandemic epidemic control response and preparedness. So that's also covering the not only COVID and then more other communicable diseases, vaccine preventable diseases. It's also it's already mentioned about maximize coordination and partnership. So we need to have one voice and one approach. So, for example, in this region, the regional communication committee engagement technical working group with the WHO, UNICEF, we are having a webinars or training together, developing the training materials, same package, to have one voice to reach out to all the population. And lastly, also very important, improving our coordination between Ministry of Health, Public Health, and also our Red Cross national societies in each country. And as a Red Cross represent is added value, our volunteers network is very strong. Every country, anywhere, our volunteers there, very much accepted by community, and we have already trust through the past, not only that this current pandemic, in the past, historically, we are always there for the people in need. So that's a trust and acceptance is our very huge added value to reach out and also distributing a communication with community. So I'm going to introduce two examples from this region. One is from Lebanon. As you may know, Lebanon has the only COVID pandemic and also the very difficult economic crisis right now. As last year we had a port explosion, we lost 200 people's life, and also more than 30,000 people lost the house. So then we have the Red Cross built a very strong system to holistically from the hotline and also dispatch the medical personnel and there's ambulance to support suspected cases or confirmed cases. Also the vaccine side, the standby for the first aid support, also psychosocial well-being, and also the cooperation among the internal and external partners to tackle this COVID as well as vaccination. And also another example in Morocco. So Morocco is from the early stage, they've developed a very good relationship with Ministry of Health to be a part of the national vaccination campaign, reach out to the also more priority the population. So they have more than 2,000 volunteers are engaged, and at the station, also the community, so community level, the social mobilization, and also sensibilization. So here's some summary of the pictures and how they work. So from the entry point to the crowd control, and also the entry point, they have a registration and a free vaccination checkup, taking pressure measures, and explain how about the information about the COVID vaccines, and then going to the after the vaccination. Also, they assist some people to move from the site to the home, and the elderly population, and also some people with need support. And also after that, also helping print out the certificate that they can take home. So this is some of example from our organization, and 17 national societies working very hard, and we are voluntary organization. Our workhorse is our volunteers on the ground supporting the Ministry of Health and other organizations. The equity and equality vaccination on the COVID, and also team vaccination. Over to you. Thank you very much.
Thank you, Maki. Thank you, sharing, all the examples, horrific challenges in the Lebanon, and the great work you continue to do despite all these challenges. Very inspiring, and thank you. Now we'll go to the lightning round. We'll have a question posed to all three panelists who have talked. First Miraf, then Dr. Samsudeen, and Maki. And my question to you is, what do you think are the key actions that national leaders must take to ensure that we do not lose sight of the need to scale up routine immunization services throughout the pandemic, and to make progress towards the vision of IA 2030? And very briefly to all three of you, starting with Miraf.
Okay, thank you very much. So looking into the key action national governments should take, I will list a few of them. The first would be improving financing for immunization, including efficient allocation of budgets for primary health care to deliver vaccination for vulnerable children. The second is improved integration of service, because there is a global crisis and financial crisis, and we need to be efficient in integrating and delivering of key interventions for vulnerable population. So to reach children with immunization, treatment of common childhood illness, growth monitoring, nutrition screening, counseling, all at the same time when a child is coming to the health facility. So integration of service is very important. The third is coordination and partnership. So during the pandemic, Ethiopia has successfully conducted a measles campaign and vaccinated over 14 million children with over 97% coverage. So that was possible with a good integration and collaboration among different stakeholders, including high-level government officials and party officials. So this has helped in successfully delivering the vaccination during the pandemic. So coordination among partnership and involving stakeholders in having a consensus on the roles and responsibilities of every stakeholder will bring a better change in equitable delivery of immunization service. And the last one is empowering community to improve both uptake of immunization in the community, because there are influential leaders in the community that the community trusts. So involving them is very important to boost their trust and improve uptake of immunization service. Also to hold the government and service providers accountable to give quality service. So these are the major actions I want to forward. Thank you.
Thank you. Dr. Samsudeen?
Yes, I partly agree with what Meera was said, especially on the funding, yeah, and also having the stakeholder involvement. In the case of Indonesia, if we use Sinovac, for example, the vaccine that we need to buy is 360 million vaccines. That's a big number. So having said that, the funding will be one of the most important ones. Number two is that we should put a consistency as well, especially on the priority. Who will be vaccinated first? Either the populated city, or according to the age, or according to the profession. So this is a very important one. I just want to stress on one thing in the case of Indonesia, that the government cannot do by himself. Can you imagine 360 million vaccines, meaning that every day at least 1 million people should be vaccinated. So if the government can allocate the vaccine within that number, the implementation is still the issue. And that's why, on the case of Indonesia, I would like strongly recommend that to involve the people who are in the field of the health and the hospital to be together, to put all the effort to make sure that 1 million vaccination can be done every day. Thank you.
Thank you. And Maki, you're the last on the line.
Okay, always the last one is a difficult, already covered all the important component. Yes, of course, the financial and also the partnership is very important. Also strategy. I think our colleagues on each country has a very lack of strategy, is not clear strategy. It's very difficult to work with. So from there, because we can identify each organization's clear role and responsibility to work together for the then link to the coordination and the cooperation to towards our goal to work together. And then of course trust is another thing. Trust. This trust is not a one-day job. So we have to have a long-term trusted relationship with communities. So utilize, I explained about our added value, our volunteer networks, national societies in the country. They are already trusted, accepted by the community. So utilize those already existing capacity to maximize and also expand and reach out the equity and the quality of services that the vulnerable population. And of course, the advocacy is another main challenge and a main key point. Particularly, I mentioned about the MENA region, as well as other regions where those people on move. They don't have a status, something they are not registered. How to cover, how to reach out without reaching out them. So we can't have any a safe environment anymore. So that's the strategy, finance, power, and coordination, and also how to reach out, utilize existing capacity. That could be an important part of the achievement to achieve our goals. Over to you.
Thank you. And indeed, resources, efficiency, accountability, partnership, and a partnership that's true, collaborative, equitable partnership that engages the community at every level, from concept to implementation, to find people who are not registered. So those are some of the things, and improving finances for immunization, key interventions to for vulnerable populations, and empowering communities. Thank you so much for sharing your thoughts. And indeed, 1 million vaccinations a day cannot be done by the government itself. It needs multi-stakeholder engagement. Now let's go to our integrated PHC approach session. And thank you so much for all the incredible insights that the panelists have shared so far. And please, again, a reminder, engage with everybody on social media. You can look at their handles on the chat, and also our key messages to tag. So the WHO plays a key role in supporting vaccine programs at the national, regional, and global vaccination programs. Evidence has shown us that an integrated PHC approach is critical for reaching every child and immunizing every child. Immunization can be an effective entry point to access health services. Integration is one of the key guiding principles of the Global Vaccines Action Plan. We call it GVAP as a short. And now Dr. Ephraim, who is joining us from WHO Africa Regional Office, I go to him. Dr. Ephraim, can you please share how is WHO supporting and can support countries to ensure that immunization programs, including COVAX rollout, are closely coordinated and work in tandem with the PHC services rather than diverting resources from them at the regional level? Over to you, Dr. Ephraim.
Thank you very much, Dr. Vineta, for the opportunity. My name is Ephraim. I'm the focal for essential immunization in primary healthcare within the WHO Regional Office for Africa. I'll be very happy to start reflecting on this very important question by simply demonstrating some of the key illustrative examples that really show the importance of having strong systems to even, in fact, build strong immunization systems. And I think it's important to start by stating and reiterating again that WHO is very committed to make sure that health systems are built and health systems become strong, so that health systems will be on a stand where they are able to provide specific services, including immunization and other essential health services. And we strongly believe that vertical programs are likely to sustain and likely to impact more number of people and are able to reach the last mile when health systems are strong, particularly when primary healthcare systems are strong, given that it's primary healthcare systems that are quite close to the community in the last mile. I think there are a few examples that can show how important it is to work on health systems. Number one is the fact we have regarding zero-dose children, and earlier Dr. Chizoba really shed important lights on this issue. In the African continent, particularly in the African region, if you compare it with the global burden of zero-dose children, close to 25% of zero-dose children or children who never had any opportunity for a vaccination resides within the African region. And the under-immunized children are also significant in number. And even if this number clearly tells that the continent is a place where a considerable number of children are not really getting the vaccines they deserve, even a chance, it also shows when you really do a deep dive, it clearly shows that there are only few countries which actually account for the significant number of these zero-dose children. For example, if you count Nigeria, Ethiopia, and DRC, these three countries can actually contribute about 68% of the zero-dose children. So there is a significant number of children that remains unreached. And if you increase this list to about 10 most high burden countries in the African region, it accounts for about 86% of this. One very important fact and revelation in here is these zero-dose children are heavily present in areas where there is conflict and in areas where there is limited access to service, particularly in urban poor communities, and also in remote rural populations in pastoral and agrarian areas, but still remote rural population, which are not really accessible by services. So it really tells that it's not only immunization services or zero-dose children who are highly dominant in these settings, but also access to essential services such as maternal and child health services, infectious disease services such as malaria prevention and treatment, TB and HIV services. All these services are quite lower in terms of access and reach to these last mile population. And most of the zero-dose children are actually present in missed communities that are unlikely to be reached and unlikely for many programs to reach. So I think it's a clear indication that strong systems are quite imperative to really reach these specific children. And another important revelation and example is what we have seen due to the impact of COVID-19, whereby as COVID-19 became the biggest challenge in overstretching systems, it has completely overwhelmed the key primary healthcare activities due to several reasons, but mainly due to repurposing of existing resources, particularly workforce, to be able to respond to COVID-19 and COVID-19 related activities. And this has significantly impacted immunization, but parallelly, it has equivalently, if not worse, has affected other essential health services such as antenatal care services, skilled birth attendants, and postnatal care services, and also other child health services have been affected. And to give you a very stark number is that in the first 6 months of the pandemic, when you compare it with what we have been able to cover in the previous year, we have learned that close to 1 million children have actually missed their first dose of, they have missed their third dose of DTP3. And close to 860,000 children have missed their measles vaccine due to this challenge. So the overstretching of systems that have been actually revealed by this pandemic also tells the vulnerability of our primary healthcare systems. And it is due to this and other actually clear examples and evidences that we promote the need to strengthen immunization systems as part of primary healthcare system. And it is strengthening and investing in primary healthcare system that can create lasting impact on access to immunization coverage. One very important example associated with this is even though the current discussion about the COVID-19 vaccine rollout is related to equity and the need to reach everyone, etc. But there is a new emerging risk that we are seeing due to introduction of COVID-19 vaccine, because the number of people that you will be served by the primary healthcare system will at least double, especially if you look at it from immunization perspective. Most of immunization nurses used to only vaccinate children and perhaps adolescents, depending on which country they are in, depending on what they have in the routine immunization system. But now that we have the older age population and the adult population who is going to join within this, seeking these vaccines, it is obvious that going forward, our primary healthcare systems are going to be stretched. And such stretching of system is likely going to worsen what is happening in immunization and at the same time in other services. So strengthening primary healthcare systems as the main overarching approach is critical. So WHO actually, in the African region particularly, one of the key tools that we are using to really run this and translate it into clear practice is that the Immunization Agenda 2030, which has its own major departure from the Global Vaccine Action Plan, in really bringing immunization systems onto the forefront to really be able to reach everyone and save lives and also improve equity while strengthening systems, is a critical tool going forward over the next decade. And the regional committee in the African region is currently working to operationalize the IA 2030 agenda into the regional framework. So one critical aspect of this is that now we are developing the operationalization plan for the IA 2030, and also translating that framework through the regional strategic plan for immunization, which is currently being developed. And this will further be cascaded to countries by supporting countries to develop their national immunization strategies. And all this will be hinged on the idea of strengthening systems. And currently we're promoting also service integration and interfaces by doing a continuous follow-up of health service continuity, which is one of the things we are doing as we respond to COVID-19, is to really follow up what's happening in all system aspects to say whether this is continuing or not. And finally, it's just to state that immunization systems are one of the key entry points to strengthen primary healthcare settings, given that there is high coverage of immunization activities. And if you compare it with other primary healthcare indicators or service indicators, immunization does have a better reach than other key systems. So integration, and at the same time also aligning some of the critical campaigns in maternal and child health, such as nutrition campaigns and deworming, etc., can actually use the immunization platform to reach the unreached. Thank you so much, Dr. Vinita, over to you.
Thank you, Dr. From. What a great insights into the systems and how the system is overstretching. The system is going to test the vulnerability of or PHC, and how can we get ahead of it rather than breaking it down. We can learn from it. PHC is foundational to achieving health for all and vaccination equity. And vaccination equity, as all of the panelists have talked about at one point or other, includes all vaccination for everybody. And so now transitioning to the global level, we have Dr. Singer, Special Advisor to DG WHO. So Dr. Singer, you are a very strong advocate for country experiences, informing the global community to collaborate and defeat COVID-19 pandemic and achieve vaccine equity. Many rich countries have more doses than they need, whereas some other countries have very little. Some countries have capacity to manufacture their vaccines, but are limited by intellectual property restrictions. And there are many doors that high-level countries, high-income countries, hold the key to and can open them for the global good. What do you think can be done at the global level to address vaccine equity? Thank you. Over to you, Dr. Singer.
Thank you. Thank you, Vinita. It's great to be with you. It's great to be with everyone. Let me start here. You know, there's 3 lessons from COVID: equity, equity, and equity. And my colleague, Dr. Ephraim, and I fully agree with what he said, was talking about equity in terms of primary healthcare and how it can help promote equity, how it's pro-equity at the country level. And what matters is the country level, much more so than the global level. And so I just want to start by fully agreeing with what he had to say, and to say that, you know, the shocking disruption of health services that's caused increasing inequities during COVID can be mirrored by the opportunity for an equitable and resilient recovery powered by PHC back towards the Sustainable Development Goals. So just to make that point, that as bad as it is, and it's terrible in the disaster that is COVID, PHC can also help power an equitable recovery back towards the SDGs. Now, to your question, Vinita, indeed, vaccine equity is probably the defining challenge of 2021. Is there vaccine equity? No. Of about 800 million vaccine doses that have been distributed, you know, there's a 5-fold difference between the 1-dose vaccination rates in high-income countries compared to non-high-income countries. Today, it's about 35.6% in high-income countries compared to 7.2% in non-high-income countries. When you compare high-income countries with low-income countries, it's like a 500-fold difference. So is there vaccine equity? No. Is that bad? Yes. Why is that bad? Well, firstly, you can't end the pandemic, because if it's raging anywhere, you're basically creating a variance factory that will end up all over the world. It's ethically wrong and immoral because every human life is of equal worth. It's economically not a good idea because you can't restart global trade. And I actually think it also goes to national security that has to do with critical infrastructure, of which I would say health systems and health workers are a part. So is there vaccine equity? No. Is that bad? Yes. What are we going to do about it? And that's your question, Vinita. And I think about this in terms of the 3 Ds: dollars, doses, and domestic manufacturing. In terms of dollars, COVAX, which is a partnership among many of us on the call here, WHO, UNICEF, Gavi, CEPI, and others, is the best mechanism we have for distributing equitably vaccine doses, but it has a the ACT Accelerator has a $22 billion shortfall. And that's not a lot of money compared to the tens of trillions in stimulus spending. So dollars, that gap should be closed. Doses. The COVAX facility has delivered about over 40 million doses now to more than 100 countries, and many of those countries would never have had vaccination. And so that's an equitable distribution, redistribution mechanism that we should fully support. And countries that have doses should share some portion of them, and some countries are starting to do so. Thirdly, domestic manufacturing. You know, this is the teach a person to fish, don't give them a fish version of things. At the end of the day, countries need to be self-reliant, or at least regions need to be self-reliant. You don't want to be dependent forever on vaccines that come from outside your region. And so that's why WHO launched last Friday a call for technology transfer of mRNA platforms to identify producers and to help transfer the technology to essentially help regions and countries become self-reliant, and why also WHO supported calls for temporary suspension of intellectual property to facilitate that. So in summary, the lessons of the pandemic are equity, equity, equity. I just wanted to completely agree with my colleague, Dr. Ephraim, and highlight the opportunities out of this terrible tragedy, worst in 100 years, for an equitable recovery to the SDGs, because the action is at the country level in primary healthcare. But then zeroing in on vaccine equity, one of the defining challenges of our time. Do we have it? No. Is that bad? Yes. What can we do about it? Dollars? Close that $22 billion gap. Doses? Share doses, because every human life is precious. Domestic manufacturing has to be strengthened, because ultimately this is an issue of sovereignty, self-reliance, and dignity of every region in the world. Thank you so much for the opportunity to be with you, and it's been great to listen to the panel. It's a real privilege and an honor for me to be here with all the panelists across these wonderful organizations. And thank you so much, Vanita, for organizing it.
Thank you, Dr. Singer. Thank you. And now we'll go to some of the key questions that we have received from the participants. But I just want to remind before I go there that everybody, please keep this conversation going on social media. You have everybody's handle, organization, and personal in the chat. So please use them and engage all of our panelists and yourself, within yourself and the audience. So let me go to the first question that is posed to Chizoba and Peter. How can one get involved in regional and country level discussions on IA 2030? How about we start with Chizoba and then move to Peter?
Okay, thank you very much for that question. I think the first thing to do is advocacy, getting involved in the advocacy efforts that's being rolled out starting from this month. I shared a slide that showed the different moments during which we can get involved and lend our voice to the vision of IA 2030, which is really on equity, country ownership, and leaving no one behind. I know that there are, if you are on social media, you can join, you can tweet. There are tweet messages that have been made available. And then if you want, we can actually share with you the social media tools that you would require. That this is a practical example of what you can do. With your email address, Diane will share that with you. And once you get back, just start tweeting and start putting out the message out there. The second thing you can do if you're on an organization working on immunization or working on anything for that matter, is really to engage your country immunization program and key into any activity that is being organized around World Immunization Week or African Vaccination Week. I know that in many countries right now, they're starting to organize around this. So key into it, be part of the activities, be part, if there's a work that's happening, join the work, if there's an outreach that's happening, or organize your own network of people to do something around immunization, particularly this World Immunization Week. And then more longer term, it's really about ensuring that in your own space, in whatever you do, that you always promote immunization with whatever mechanism or platform that you have. So IA 2030 is here to stay. IA 2030 is going to be a people's movement for vaccines, COVID-19 vaccines, childhood vaccines, adult vaccines, adolescent vaccines. So let us be part of the movement. That's my message today. I really want us to stand up and be counted among the movement of IA 2030, because it's going to get us to that vision of leaving no one behind on immunization, on COVID vaccines. Thank you very much.
Thank you. Peter, you next. How can one get involved in regional and country level discussion on IA 2030? Any thoughts on that? Okay, let's move to another question that we have for the CSO representatives, Mirav, Dr. Samsudeen, and Maki. So you can take the question in the same order, or we can reverse it, Maki. This time we can put you first. How are the changes in global immunization architecture impacting the local level operations? We'll start with you, Maki, and then go to Mirav, and then to Dr. Samsudeen.
Okay, thank you very much. So now from my side. So for the local level, so I think it's localization, so it's already many people mentioned about. And so for us, it's a cross-recurrent movement, the community-based surveillance system, and also linkage between our community mechanism to the Ministry of Health and those provincial and the national level to be online, to be all connected. So that's one thing to be. And then also already we have some example of the working together with the WHO, the UNICEF, and then those stakeholders to make sure that everybody's on the same page and then to work together. I think that's for just to think of for two major part of. Over to you.
Mirav.
Okay, thank you. We are using different platforms to cascade the global level movements to national levels, including in immunization, national and subnational task forces and CSO platforms. We also chair the CSO immunization platform with a membership of over 160 CSOs. So that the global movement for equity it will be important to reach all vulnerable children across the country and reach the gap. Thank you.
Thank you, Dr. Samsudeen.
Yes, I think it's very critical that we address the equity of vaccination. The impact of this pandemic is even wider because of the economic factors, because of the social factors, and also the individual factors. However, I think I agree with Maki that the alignment between global and national and also local is very important point on this stage. And last but not least is very important is on the implementation. Yeah. How can we make sure that those who are disadvantaged will still get vaccinations what they need, So involving stakeholder is one of the very important point on this. Thank you.
Thank you so much. And the next question from the audience is for Dr. Chizoba. How is the IEA 2030 impacted by COVID-19 pandemic response? If you can talk a little bit more about it. And also there's another question that I want to add to the same one in the same line. Where does the COVID-19 vaccine fit in IEA 2030? So two part of the same sort of dialogue. Dr. Chizoba.
So the first question is, how does IEA 2030 align with the COVID-19 vaccine? Yeah, so the COVID-19 vaccination effort is it's a vaccination effort at its core. So it is under the mandate of the IEA 2030. So IEA 2030 is this umbrella immunization strategy for all vaccines for the world. So it's not just low and middle income country, but it's for all countries in the world. And when you think about the COVID response and the COVID vaccines, there are a couple of things that we highlight. One is equity in access, making sure that everybody has equitable access to COVID vaccine. That again is one of the strategic priorities of IEA 2030. I mentioned strategic priority 2 that talks about commitment and equity. The second one, when it comes to COVID vaccine, is the issue of outbreak response, pandemic response. So IEA 2030 has laid out strategies for responding to pandemics with vaccination. And that also is aligned with what the COVID vaccination effort is doing right now. Another thing to consider, another alignment point is the issue of life course. So for the first time, the immunization strategy is focusing not just on childhood vaccination, but on vaccination across the life course, because we recognize that even beyond infancy, there are vaccines that help protect health and reduce mortality across the life course. Adolescent vaccines, we're talking about HPV vaccines. When women become pregnant, we're talking about maternal immunization, tetanus. Now we're talking about flu. And then even in older adult age groups, we are looking at pneumococcal vaccination. So COVID vaccine right now is an adult vaccine. And so it fits into that framework of immunization across the life course. So what you can see is that when you look at IEA 2030, you can locate the essence of whatever program around immunization that you are kind of focusing on. So it is that umbrella that we're using to drive immunization action in the world. What was the second question?
Second part of the question was that how is IEA 2030 impacted by the COVID-19 pandemic responses? It's kind of a similar, both were similar questions. So anything that you would like to sort of add to that? And where the COVID-19 fits, like vaccine fits into the agenda. Like IEA 2030 is a broader immunization, and how much and where and how it fits COVID-19 vaccine. Okay, so in the sense of how is COVID-19 impacted by the IEA 2030, I want to see it as an opportunity, right? I want to see COVID-19 vaccination and all the attention on it as an opportunity to put IEA 2030 front and center, right? As this new strategy for immunization. So IEA 2030 will ride the wave of the COVID vaccine awareness. That's really what we want to do. And in terms of impact, we don't want the conversation to just be solely about COVID-19 vaccines, because from the presentations that were made, you can see that there's a risk to disruption of essential services and other vaccination programs. So we don't want the push for COVID vaccines to eclipse the need and the imperative for other vaccines to be delivered to children. Measles, for example, right? If we
if we miss our mark on measles, we can see measles outbreak, and that will cause more childhood deaths than than we could see with COVID. So we want to make them be complementary to each other and not allow one to disrupt the other. So that's the major message here. Use the momentum of the attention on COVID-19 to bring IA 2030 and bring all immunization to the fore, while at the same time be sure to avoid a disruption in other immunization and essential services. Thank you.
Thank you so much. And now there's another question to all the panelists. Anybody can take it to start with, and it would be really great if more panelists can reflect on it. And the question is self-reliance the goal? Are there more rational models possible for sharing resources? So any thoughts and comments that any of the panelists might have, please get started. Anybody?
Maybe I could jump in because I talked about self-reliance. Listen, the goal is saving lives. It's vaccination, and it's vaccine equity, and it's redressing the terrible inequities in COVID vaccination that we talked about. And it's vaccinating essential workers who are risking their lives, and it's vaccinating health workers, and it's vaccinating everybody who wants a vaccine in every country in the world. And of course, combining that with public health measures. So that's the goal. But I think what my friend Lisa Eckenweiler was getting at, who asked that question, is self-reliance seems like an awfully individualistic, kind of Ayn Rand type of, actually at that level, I think, as Lisa would admit, and her scholarship, the goal is solidarity. The goal is interdependence. The goal is mutually working together across the world to create a better world. It just turns out that you have to do that from a position of not complete dependency. And take the example of vaccines, I think is a good one. And that's really the point I was making. So the goal is saving lives. The goal is vaccine equity, the defining challenge of this year. The channel or the route, if you will, is sharing vaccines and sharing dollars and domestic manufacturing, because we need solidarity across all three of those things. And solidarity is sometimes strengthened with a little bit of independence or self-reliance. And that's really the point I was trying to make. And thank you so much for the question. Solidarity is more important than self-reliance, but self-reliance helps, it turns out, helps generate a little solidarity.
Thank you. Any other panelists would like to comment on it? Any further thoughts?
If I may,
Yes,
Vinita, I just wanted to compliment and perhaps a bit extend what my dear friend Peter earlier said about the value of building global solidarity. Some of you may have heard of there was this big virtual conference that was organized by the Africa CDC to really speak about vaccine manufacturing in the African region, in the African continent. And that agenda is quite important agenda and a very timely one for a few reasons. Primarily, it is obviously self-reliance. It is a context of the need to build capacity, a minimum level of capacity that can help countries really do the first mile of responding to such kinds of pandemics, and having the capability to actually work with and the capacity to actually work with other well-built systems, so that they are not solely dependent, they are not fully dependent on the mercy of the others who are able to offer these services. So I think what COVID has really shown us is this stark difference in capacity globally. And obviously, even though we talk most of the time about the inequity and the challenge we are facing in some countries benefiting more than the other, while building the global solidarity, there is a very important thing that has really emerged after the pandemic is there is also an immense level of collaboration that we are actually witnessing, whereby the global community actually came together, orchestrating platforms such as the ACT Accelerator wouldn't really be possible in those regular days in such a short time, unless and otherwise there is a pandemic that can actually affect everyone. In these days, the level of commitment actually goes up to a level of discussing new modalities of funding, the post-pandemic period and building back better. I don't recall a conversation about even, discussing special drawing rights of countries within the IMF to actually finance some of the critical health system issues. Mainstream lenders such as the World Bank came in and invested a lot of amounts of money, availed a lot of money, and bilateral donors also gave a significant amount of resources. We are currently at the early stage of the challenge. And of course, usually when you really get to such competition, obviously the rich ones will take the first small available amount of doses and dollars. But at the end of the day, after 2021 particularly, there will be adequate sense of supply. But the key question is that we should not continue to only speak about availing COVID-19 vaccines. We really need to talk about using these platforms, using these commitments and using this finance to build systems which are able to become resilient on their own, and they are able to really defend the next pandemic, which is not really something that might not happen. It may happen in the next 3 to 5 years period. So it's building systems using this commitment. Let's use it so that we can build back better. And I guess I'm saying again what earlier Peter and Chizoba was also raising. Over to you.
You, Ephraim and Peter. There was another panelist that wanted to add something.
Can I just want to add something? As Peter said earlier, that transfer of technology will become very critical, because at the end of the day, the issue will still be the same, right? The availability of the vaccine. Number two is the access to the vaccine itself. So I was expecting that some movement in the future to, to get along together. Let's say, for example, to make a vaccine centers in one region, because I believe in the future, as Dr. Ephraim said, it might happen again. We don't know yet, but the technology and the knowledge of vaccination, it should be distributed not only in Europe or in America, but it should be also distributed also to Africa, to Middle East, and also to Asia. I think if the WHO can push that on that direction, it will be very nice to see in the future. Thank you.
Thank you. Thank you very much. And manufacturing capacity within the countries and the intellectual property complexity really calls for solidarity and leadership from high-income countries. Thank you so much, everybody, for attending this webinar. Thank you to the panelists. It's been an honor to be part of this conversation and have you all here today to discuss and hear. And I'm hoping that this conversation will continue. You will engage with all of us. Have a great rest of the day. And don't forget, please, to engage on social media during World Immunization Week as well. Dr. Chizoba also mentioned that. It starts on Saturday, April 24th. And information you can see, it's on the slide as well. It was on the slide. And feel free to reach me at Gupta Vinita on Twitter and share your thoughts and comments with me. Thank you, everybody. And hope to see you next time in the next webinar. Bye-bye.
All right, thank you.
Bye, everyone.
Thank you, everybody.
Thank you.
Thank you, everyone. What a nice conversation we had.
Thank you, it was great.
Thank you.